Hi, it's Cindy. Today we're going to talk about Chapter 4, the respiratory system. The first procedure we will look at are the nasal sinus endoscopies. These allow the physician to visualize the interior of the nasal cavity, all the various parts, and that is diagrammed for you in Figure 4.9 in your CPT textbook. Endoscopies can be diagnostic or surgical, and we're going to take a look at the guidelines in the CPT Code book. I've reproduced the color structure there in the CPT book, where the red font represents a part of the respiratory system, and then the endoscopy represents the type of procedures that you're looking at. And we have guidelines here. I've underlined several things. One is that a surgical endoscopy includes a diagnostic endoscopy, so you're not going to code the diagnostic if you're having a surgical. The codes do describe unilateral procedures, so you'll have to add a -50 if you're doing the procedure having it on both sides of the nose. Here's what we're going to look at. Exercise 415, number 2, a left nasal endoscopy for control of epistaxis. Epistaxis is severe bleeding, nosebleeds. Here's the code, the modifier, as well as the path. You can use endoscopy as your main term or the nose. Either way gets you there. And don't forget your modifier. The final code, 31238. I'll show you here from the code book. The parent code, nasal sinus endoscopy, surgical, and then the final code, 31238. with control of nasal hemorrhage. And you see how I've drawn a half circle around those two codes and the arrows. And the arrows tell me that on the next page is a continuation of this family of codes. Now we'll look at the laryngoscopies. Following the same color format of the CPT code book, the larynx is the part of the respiratory system we're looking at. Endoscopy, the type of procedure. And an endoscopy on the larynx is called a laryngoscopy. There's 2 slides here that have the guidelines, and I've highlighted things there, made a couple of notes. Note that the paired structures, and it tells what they are, for the purpose of reporting therapeutic interventions, all paired structures contained within one side of the larynx are considered unilateral. That's important to know. And if you're using an operating microscope, telescope, or both, you're going to use the applicable code only once per operative session. General guidelines, but still important to read them. So the questions we want to ask ourselves before we assign a code for a laryngoscopy: what's the purpose of it? Which type is being used? And the types are direct, indirect, and flexible fiber optic. And is a stroboscopy used? Stroboscopy is like a strobe light. It really enhances what the physician can see, and it is used on some of the laryngoscopies. And here's our first question. Exercise 417, number 2. A flexible fiber optic laryngoscopy performed for removal of a dime lodged in the patient's larynx. The purpose is to remove the foreign body. The type, it tells us it's a flexible. Doesn't mention a stroboscopy. So here we have the code, the path that was used, and here we have the parent code on the left, so you can see where that came from, and the final code, 31577, on the right. You see the parent code is laryngoscopy flexible diagnostic at 31575. That's the parent code. It's at the bottom of one page, so I have my half circle around the family with my arrows. And then I come to the next page, and you see I have my arrows now going up to tell me that before these codes, the family of codes is on the previous page. Just wanted to show you, using the split screen here, how I make sure that I'm looking back far enough to find that parent code. Here's an indirect laryngoscopy with a biopsy. So the purpose is a biopsy. It's indirect. No stroboscopy is mentioned. Pretty straightforward. And here we go. Your parent code is a laryngoscopy indirect diagnostic, but in our case, we are using it for a biopsy. So our final code is 31510. So now let's look at the endoscopy of the bronchi, which is called a bronchoscopy. The red font tells you I'm in the trachea and bronchi section of the respiratory system. The endoscopy is the type of procedure we are looking at. So a bronchoscopy is an endoscopy of the bronchi. And I mentioned here, it's mentioned in the guidelines, the surgical bronchoscopy includes a diagnostic bronchoscopy when it's performed by the same physician. And its range of codes that are given there includes fluoroscopic guidance when it's performed. Two codes were mentioned, 652 and 653, as complete services used for sampling lymph nodes or adjacent structures utilizing EBUS and are reported separately. And last of all, code 31654 is an add-on code used for reporting one or more peripheral lesions with transendoscopic ultrasound. So the questions you're going to answer before you assign a code for a bronchoscopy is: why was it done? Was it a diagnostic done in conjunction with a surgical? And if so, you're only going to code the surgical. Was the procedure one of the bronchoscopies described by a code from the series 31622 through 31651? If so, fluoroscopy or fluoroscopic guidance is considered part of the procedures within that range of codes. And here you see exercise 4.19, number 2, bronchoscopy with a transbronchial biopsy of the lung. Why was it performed? A biopsy of the lung. Surgical diagnostic, it is diagnostic, because we're trying to figure out, when you're biopsying something, you're trying to figure out if it's cancer most of the time. Is code in the range here, 622 through 651? If so, fluoroscopic guidance is considered part of the procedure. And there we have the code, the way it's described in the code book. Bronchoscopy was the main term we looked at in the index. And looking here, we see the parent code 31622 on the previous page, and I'm just showing you how I got to 31628. The answer is 31628. But I want to make sure that you understand that I am going back to the parent code, and then I start looking under there, and that is in the range of codes that the index tells me to look at. I've selected 31628 as my answer. Also notice I have an asterisk here. It says 31628 should be reported only once, regardless of how many lung biopsies are performed. So just keep that in mind too. It's in the lobe. How many lung biopsies are performed in a lobe? I have to force these screenshots to make two of them fit on the slide, so that's why they are distorted. My apologies for that. Now let's look at a bronchoscopy with an EBUS guided transbronchial sampling of 2 mediastinal lymph nodes. I have everything in the purple font because every word in that is important. An EBUS is an endobronchial ultrasound. It's used to diagnose anything that would cause enlarged lymph nodes in the chest. So here I have the code as well as the index. And here you see the code, 31652. I didn't bother to put the parent code on this one, but I think you've got my point now. Whenever you see those half circles with the arrows, it tells you that the parent code was in a previous column at the bottom of the page. And I did make a note for myself to report it once per session, no matter how many bronchial samplings are taken. You do notice, too, that this specifically says the mediastinal and or hilar lymph node stations or structures. So it is looking at a specific lymph nodes. Exercise 420, number 2, is an operative report in your textbook. and these are the answers. Exercise 421, number 2, percutaneous drainage of a pleural cavity via indwelling catheter with imaging. I wanted to tell you that the main term for drainage is puncture, because you have to actually go through that covering over the pleural cavity to place your catheter, and that is done with imaging so that you don't puncture anything you don't want to. Here's your code and your index. I wanted to show you this slide because it's kind of like a warning. You see code 32556 is up here and 32557 below the diagram. And the thing is, the diagram is about something completely different. The diagram has split a family of codes and is placed right in the middle of codes it doesn't even apply to. So be extra careful when you're looking at diagrams to be sure you are looking at the diagram you want to look at and the associated codes, because that could really get you in trouble if you thought that the thoracentesis was one of these two codes above and below the diagram, because it isn't. Here it is. This is below that diagram. I wrote the parent code, pleural drainage percutaneous with insertion of indwelling catheter, and what made it correct is it adds with imaging guidance 32557. Exercise 421 number 4 is a flexible bronchoscopy with bronchial brushings and cell washings. Why is it performed for cell washings? Surgical or diagnostic? Diagnostic. And is fluoroscopic guidance included? Yes. And here are your codes. You notice that bronchoscopy and brushings are separate from the code for cell washings. And here's those two codes. 31622 are your cell washings, and 623 are your brushings. I should have put both of those in the title there. In our next problem, the patient was treated in the emergency department for severe epistaxis. This is another of those severe nosebleeds. And the physician is performing extensive anterior packing bilateral. So those significant words are the packing and the extensive and bilateral. So when you look in the index under packing, there is a code for nasal hemorrhage. You can also find it in a roundabout way using epistaxis or hemorrhage. You note that our documentation tells us that it is extensive. There's no way you could know unless the doctor said so, whether or not it was extensive. And don't forget modifier 50 for the fact that it was performed bilaterally. And here's that code, 30903, and you note that extensive is part of your description, and also that reminder about if it's bilateral to add the modifier -50. A revision of a tracheostomy scar is one of those other procedures that are mentioned in your textbook. There it is, 31830, and here it is. I have it underlined in the CPT Code book. Whenever I have a code that's a single code without codes under it, I just do a little underline, and that tells me that it stands alone. Next, the patient has a history of persistent hoarseness. The surgeon performs a flexible fiber optic laryngoscopy to evaluate the larynx. So the purpose of this laryngoscopy, it was diagnostic. What type is being used? It's flexible. A stroboscopy was not used. So here's your codes, 31575. And here we have it from the CPT Code book. Okay, if you have any questions about any of the problems on this podcast or from your textbook, please place them in discussion board along with the path that you used to try and find them. Thanks so much and have a good evening.